With the country deep in the throes of a nursing shortage, big questions today about a new edict from the Department of Education. The department no longer considers nursing as a professional degree, a move critics warn could shrink an already strained workforce. The reclassification will limit the loan and loan forgiveness options available to students in those nursing programs.
It is getting crazy. When I had the news, I was like, hold up. The nurse. I was confused. Are we talking about the same nurses that are holding the hospital down? Are we talking about the same nurses that had it down during COVID? Are we talking about the same nurses that leave their family to take care of other families? Yes, we are talking about that same nurses. Yes, we are talking about that same nurses. This administration said that nurses, they are not considered a professional degree. But the reaction on the news, on the internet, it's going crazy. Credit to the creators. Let me roll the clips.
Trump administration is trying to make it a lot harder to go to graduate school and get an advanced education if you don't come from a wealthy family. Because up until now, if you were getting an advanced degree, becoming a nurse practitioner or a physician assistant or a physical therapist or a school counselor, you could borrow the money you needed to pay for school and then you paid it back with interest. That's how people without wealthy parents became scientists or healthcare providers or mental health professionals. But tucked into Trump's big beautiful bill is the elimination of those loans. And instead, the bill creates strict caps on how much graduate students can borrow. And what's wild is that they've now created two tiers of graduate students. Tier 1 is a very small set of degrees the administration decided count as professional, including medicine, dentistry, pharmacy, chiropractors, and theology. But everything else is no longer considered a professional degree, and so they're capped at borrowing $20,500 a year, even if their program costs 2 or 3 times that. And guess which degrees are suddenly not considered professional? Nursing, nurse practitioners, physician assistants, counseling and therapy, social work, public health, education. Almost every single one is a female-dominated field. Almost every single one is essential to health equity, meaning the basic idea that everyone deserves a fair chance to be healthy. And almost every single one costs far more than $20,500 per year to attend. So the obvious impact is that students in these professions, which are overwhelmingly women, often first generation, often coming from the same communities they then go back to serve, will no longer be able to borrow enough to enter these fields at all. They simply won't be able to afford it. And this tracks exactly with the Project 2025 playbook, which aims to shrink federal financing for graduate education, especially for care-based, female-dominated, equity-focused professions that aren't geared toward corporate profit. So if you care about having enough nurses, NPs, therapists, mental health care providers, speech therapists, school counselors, this affects you. If you care about kids, older adults, disabled people, rural communities, maternal health, mental health, this affects you. And even if you don't care about any of those things, this affects you. Because if you cut off the pipeline for care-based professions, you guarantee a sicker, more unequal America.
So Trump's government's coming for nurses now. Here's what's going on. He wants the Department of Education to declassify nursing as a professional degree, advanced practice nursing, like our CRNAs, our nurse practitioners, our masters. Why does this matter? Because nursing is one of them careers that pull you up out of poverty. Gives us a great opportunity to provide for our families and for our life. Most homeowners I know, nurses. A lot of heads of households, nurses. A lot of minority women, nurses. So declassifying us as a professional practice, you thereby limit our access to funding. So you limit a lot of women and minorities women access to further climb the socioeconomic ladder. Yes, this is why it's such a big deal, gang. You think these little insidious things don't matter? They always matter, and there's always something that happens at the end of that affects people. And these type of things will affect patients, specifically patients. I'm one nurse trying to spread the word, so if you can, make as much of an uproar as you can.
Uh-oh. The Department of Education doesn't think that nurses are professionals. That sounds dramatic. It also sounds so insulting, but it's just not true. And let me explain. Nurses are professionals. CRNAs, professionals. NPs, DNPs, all professionals. None of that is changing, not even a little bit. What is changing is the thing that universities hope that you wouldn't notice. The federal government is finally turning off the unlimited money hose. For years, graduate programs could charge any tuition they wanted because the government would always let students borrow enough to cover it. No cap, no limit, no financial pressure, and schools took full advantage. $80,000 programs became $150,000, $120,000 programs became $200,000 programs. Tuition rose faster than inflation, wages, and the cost of actually providing that education. Not because it cost that much to train, but because they knew that you could borrow that much money. Unlimited loans equal unlimited tuition hikes. Now, here's the part that you need to hear. When you remove unlimited borrowing, the government says no more blank checks, there's a limit now. Suddenly the schools have a big problem because without unlimited federal loans, students can't cover sky-high tuition. Enrollment drops, revenue drops, and institutions are forced to face the reality that they've been avoiding. Their prices are unsustainable. And that is why caps exist, not to downgrade nursing, not to insult anyone's profession, but to finally put pressure on institutions that have had zero incentive to lower tuition as long as students can borrow unlimited debt. Let me say this even louder for you. Without unlimited borrowing, schools must address affordability. Not maybe, not if they feel like it, they have to. Because students can't borrow $150,000 anymore, so schools can't charge $150,000 anymore, period. So stop getting mad at the wrong thing. Don't be mad that the government is limiting catastrophic debt. Be mad that institutions built their business models on students drowning in it. Be mad that when faced with the choice between affordable education and bloated tuition, they chose profit every single time. This new system is not punishing nurses. It's finally holding schools accountable. And if anything, it's the first real chance that we've had in years to push tuition back into reality. So let's focus, let's aim our outrage in the right direction. Let's demand that institutions charge what education is actually worth, not whatever students can borrow, because nurses are professionals. They always have been, and they always will be. The cost of becoming one, though, should not require a lifetime of debt. I hope that helps.
You know, sometimes I wonder if the people making these policies have ever stepped foot inside of a hospital. Matter of fact, I already know that they don't. Because today, the U.S. Department of Education just proposed a rule that excludes advanced nursing programs. So this includes MSN and DNP programs from being recognized as professional degrees. So translation, medical, dental, and law students get access to higher federal loan limits and benefits. But nurses, who hold lives in their hands every single shift, don't. This rule, and it's a proposed rule, basically says our education doesn't rise to the level of other professions. That's not only insulting, it's dangerous. Because if nurses can't afford to advance their education, the entire healthcare system suffers. We're already short hundreds of thousands of nurses nationwide, and this just makes it harder for people to move into leadership, research, or advanced practice roles. So the American Association of Colleges of Nursing have already spoken out, saying that this decision could gut graduate nursing enrollment and widen the gap in care access. So think about it. Fewer nurse practitioners, fewer nurse anesthetists, fewer educators. After everything nurses have done, fighting a pandemic, covering unsafe staffing, getting assaulted on the job, this is how the federal government says thank you. By devaluing the very profession, keeping the system afloat. So we got to call it what it is. This is an absolute slap in the face to nursing and to every patient who depends on us.
These programs are not considered professional degrees under the new Department of Education rules, including nursing, physician assistant, physical therapy, and several other essential healthcare fields. Meanwhile, here are the programs that are considered professional degrees. Now, here's why that matters. Starting July 1st, 2026, students and programs not classified as professional degrees will be limited to an annual federal loan limit of $20,500 and a lifetime limit of $100,000. Only professional degree programs qualify for the higher limits with an annual federal loan limit of $50,000 and a lifetime limit of $200,000. This isn't about prestige, it's about access. Many nursing, PT, and PA programs cost far more than $100,000, and lowering the federal loan eligibility means that fewer students will be able to afford entering these careers. With healthcare already short-staffed, making it harder for students to enter these fields doesn't help anyone, especially patients.
Why they took nursing out as a professional degree in 90 seconds or less. First and foremost, nurses, understand that you make the world go round. During the pandemic, you were there when no one else was there, you and the doctors. So we understand that you are a professional, okay? But this has nothing to do with that. This has to do with student loans, federal student loans cap. So they just took out more than nurses, by the way, and left those that are more than 6 years as far as degrees are concerned. Think about doctors, chiropractors, dentists, lawyers, PhDs. And they're telling them, guess what? You all get a cap of $200,000 to finish your degree. And you know, it usually costs for those people about $400,000. So now those individuals in the professional category have to go find $200,000 somewhere else, probably in private student loans, which is seriously bad. So if I'm nurses and the nurses field, I don't want to be pushed into that category because it gives institutions the ability to say, you know what, future nurses, you all now can go up to that $200,000 for your degree. And I don't think anybody wants that for the field because it's already shorthanded. Now, what everybody should be mad at instead of this distraction is that the big, beautiful bill is going to make it harder to go to college and harder to stay in college. Starting in 2026, people who used to get a certain amount of Pell Grant will not get it anymore. There's no more Grad Plus loans. There's caps on the professional degrees and so much more. Let's talk about that.
The Department of Education moves to limit student loans for nursing graduate students after removing nursing from the professional degree category. Two things have happened here. Henry Mason, CEO of Precious Hospice, and the benefit of having me bring you this story is I know both what's going on with the Department of Education, but most importantly, I know how the business of healthcare works. And let me break this down for you. Two things are happening here. Number one, this is purely an attack on women. Women make up about 88% of all nurses in America. And if you do not know, to limit their ability to constantly go up, it's purely an attack, in my opinion, on women. The idea that if they become nurses, they also become nurse practitioners is what brings us to our second point. In many states, all over the country, people are wondering, what is going on with doctors? Are their degrees not as valuable? Let me explain to you what's happening. So let's just start with the state of Georgia so you have an idea. A lot of times when you go to the doctor's office, you're no longer seeing an MD. A lot of the times you're seeing a nurse practitioner, right? A nurse practitioner. So who's more threatened by the advancements of nurses in America than a person who's actually take the place of someone who has $400,000 to $500,000 in student debt? Doctors. This one to me was a no-brainer when I first saw it with the advancement of AI and the idea that now if I am the company, let's just use any hospital that you want or any doctor's office that you want. And the law states that you no longer have to have the doctor to see patients. Where's the room for the doctors now? That limits that doctor to only being able to work or only being available to just kind of go over notes and to oversee the practice of the nurse practitioner. This has to, for most people, I've talked to a lot of doctors who have all said this, they don't like this. And so that's what I see more than anything happening. Those two things. One, the limitations on women and how high they can go up. And two, doctors are just not happy about the idea that they go to school for all this time, and then next thing you know, a nurse practitioner can essentially be your primary care physician. Those are my thoughts.
Nursing is not the only program that they reclassified and no longer call it a professional degree. Here's a list right here. Nursing, physician assistants, physical therapists, audiologists, architects, accountants, educators, social workers. The United States Department of Education under the Trump administration reclassified these degrees and no longer considered them professional because they no longer want to cover them under federal student loans. So what does this mean? It does not mean that you can no longer pursue these professions. It means the federal government is not trying to pay for them anymore. So only the people that are trust fund kids or come from family that plans and save for college would be able to take these programs because they're going to have to pay for it out of pocket. It means any students that's pursuing the degrees that we mentioned before, they will no longer have access to higher federal loan limits, which were previously available to them. They will also be excluded from specific loan forgiveness programs, and these changes will create obstacles for those who cannot afford to pay for
Did you know that there are some healthcare professional degrees that are now no longer considered professional under new federal rules? And most of the ones that have been eliminated are those that are dominated by women. So let's break this down because the ripple effect is bigger than most people realize. So under the One Big Beautiful Bill Act, the government has changed the way graduate student loans work. If your program is labeled a professional degree, you can borrow up to $50,000 a year and $200,000 total. But if it's not classified as professional, you're capped at $20,500 a year and $100,000 total, even if your degree costs far more than that. So now federal officials say that its intention was to standardize in which degree counts as professional to control federal spending. That means they focused on historically high earning licensed fields like medicine, dentistry, pharmacy, law, optometry, veterinary medicine. But here's the concern. Many of the degrees that are excluded from the professional status are the backbones of our healthcare system and overwhelmingly staffed by women. Don't believe me? Here's just a few examples. Nursing, 90% women. Speech language pathology, 95% women. Social work, 80% women. Occupational therapy, more than 80% are women. And these are the exact fields that are now being pushed under the lower borrowing caps. So let's talk about what it actually means. Most of these degrees cost $80,000 to $150,000 to complete. So without access to federal loans, students are going to have to turn to private loans with higher interest. And most simply won't be able to enter these fields at all. So this just isn't a student problem. This is a healthcare system problem. We're already facing a projected 200 to 450,000 nurse shortage in the next 5 years. National shortages on speech language pathologists, OTs, PTs, and mental health care providers. Rural communities rely on nurse practitioners, physician associates, and allied health as one of their primary care workforce. So reducing access to these degrees doesn't save us anything. It's actually shrinking the pipeline, it's worsening burnout, it will increase wait times, and disproportionately harms women, first-gen students like myself, and low-income communities. And the people that are feeling the impact, it's not the policymakers, it's the patients and the frontline clinicians who are already stretched thin. Genuinely curious as to what you guys think, especially if you're in one of these professions.
Credit to the creators for giving us this opportunity to add our comment. Guys, go down in the comment section and add your comment. It is all about the dollar, yo. It is all about the dollar. According to one of the creators, she explained it. I think I kind of get it. But regardless, a lot of nurses are just like pissed. A lot of people are confused. But this creator said this administration is actually trying to tell the school that they have to reduce their pricing. If you guys understand that they are trying to target the school, they are not actually trying to target the nurses. They are trying to target the school because some programs they are not that expensive, but just because they know they can get free money from the government, that's why they are increasing the price of the program. So with this administration trying to target the universities, the schools in general, for them to reduce their programs fee, and they should not increase the programs fee just because they know they can get money from the government. But a lot of people are not seeing it this way. Because just like I said in the first segment, are we talking about the same nurses? The same nurses that they are going to leave their family to take care of our families. You know what I mean? The same nurses that they had the front, you know what I mean? They are the front line. They are the one holding it down. The same nurses that they were there during COVID. Are we talking about the same nurses? But right now, a lot of people are just confused. But what do you guys think? What do you guys think if one of the creators, how she explained it, that kind of a little bit understanding, if that's what this administration is going for, you know what I mean? Why do they have to make the nurses fewer? Because most people that, as y'all heard, the creators, most of them are pissed. How you gonna insult the nurses? But one creator said it's not like they are insulting the nurses. They just want to like tell the schools that they are charging too much for the programs just because they know the government gonna subsidize it. That's what I got from this. But regardless, however it's gonna be, I just know that our nurses, we respect y'all, we love y'all, and we appreciate y'all. Go down there and just show our nurses some love, y'all. Show our nurses some love. We respect y'all. And I am gonna see y'all. And if you are new here, thank you for stopping by, but do not forget to join the growing community because right here you are gonna get your daily gist. And thanks to everybody. Bye for now.